Hi, this is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief, and this is Tuesday, December the 15th?
Yeah.
Yep, and we have Cheryl Lynn here with us this morning, and Cheryl Lynn's coming back in from the weekend with some pain in her neck and upper back, her lower back and mid back, and some headaches over the weekend. She came in with some really bad vertigo and dizziness, which has been pretty much gone, right, and hiatal hernia acid reflux, too. So we're making some improvement. This is only her 7th visit, so we're going to show you what we're going to do for help her today. Okay, let's have you close your eyes and flex your head forward and backwards for me. Now notice the range of motion there wasn't very full, and she has what's called forward head posture in the Z-axis. She also has a translation of her cervical spine and head to the right of center. That makes her left shoulder a little higher. And she's starting to develop this little hump right here called Dowager's hump. And we see that a lot in patients who work on the computer all the time and are sitting behind high-tech devices. In fact, I wrote a blog on that on our website, advancedchiropractic.com. If you get time to read, it's a really good article, or blog, I should say. Okay, so we got her posture analyzed three-dimensionally, and let's go ahead and have you lay on your back right here, Charlene. Okay. Now she's quite a bit smaller than the gentleman you saw in our last video last night, so okay, go ahead and slide up just a little bit where your hips are at. There you go. So my force in decompressing her using the pull with the towel is definitely a lot less, but it's going to be according to her tensile strength in her muscles and ligaments and tissues, so that we don't go too far and sprain the ligaments or strain the muscles. A sprain is injury to ligaments and a strain is injury to muscles. Okay, there we go. But we will decompress the spine, taking the pressure off of the disc. Oh yeah, off the nerves. Now, did you feel that all the way down? Good. That wasn't as bad as first view, huh? Didn't hurt me a bit. Okay. Here. Okay, we got another one over here. I'm going to go lower. Perfect. Good job. Okay, so let's come over this way. I cleaned the camera lens today. We had that last video I shot last night was a little bit fuzzy, I'm sure you noticed, so hopefully this one will be a lot better quality.
I think it's that rapid release.
Yeah, the rapid release technology, when I use that, it's a real high frequency. It's running on 150 hertz, so that's tender right there, huh? See, her sacroiliac joints are very tender to the palpation, so I'm adjusting her left SI joint first. Now today she came in with pain down in her SI joints, and she's been getting some pain and numbness down in her sacral region, which is right here. That's what I'm adjusting, superior to inferior on the y-axis. There's the sacrum. Now there's L5, L4, L3, L2, and then all the way up to L1, and I'm going to put her head forward just a little bit to open the joints up. Okay, just keep breathing normal, I'll catch you. There we go. And she's awfully tight up here in this upper thoracic region where her trapezius and levator scapular. Did you feel that one? There we go, good. That'll help that low back pain. That was the lower thoracic. Her legs are even now, and this should feel a little easier this time. Okay, good. The great thing about this type of care, BioPhysics, that I'm doing, is that you will see predictable outcomes. Not something you have to wait weeks for, but you'll see them right away, and you'll know whether it's working right away or not. Now, it depends on how long a person has been subluxated or out of place that determines the amount of time that they need to be under treatment. We don't put patients on big, long treatment plans. We treat them from visit to visit. And our job is to get rid of a patient's pain as soon as possible and get them back to living their lives and move on, because I know y'all have better things to do than to come in here 2 or 3 times a week. So we don't put people on big, long treatment programs and charge you huge fees to do that. We're in-network providers for United Healthcare and Blue Cross Blue Shield of Texas, and we do personal injury protection insurance here, as well as some third-party liens. We'll be doing more of those when Dr. Junton joins the practice next year. And then we also do some workers' compensation cases if they're accepted cases. We treat a lot of veterans through Tri-West and fee basis. But last night I entitled the video "The Art of the Adjustment," and chiropractic's all about the philosophy, science, and art, and the philosophy and the science have come together really because it is known that the nervous system controls and coordinates the function of every organ, muscle, tissue, and cell in your body. So that's been always the philosophy of chiropractic. However, that has become more science now than philosophy. And the art of the adjustment is actually knowing how the joints range of motion is, the tissue play. So I'm doing this high frequency right over her SI joints and her sacrum here. It's probably going to be a little tender here at first. But people are really reporting outstanding results of this throughout the day even. I'm doing this throughout the entire length of her SI joint, which runs obliquely through the pelvis like this. And then right down in her lumbosacral paraspinal muscles on the right first. And we'll go all the way up into her rhomboids and the trapezius and levator scapula muscles right here. And then switch over to the left side. This is much more high frequency than that other vibrator, huh? This breaks up fibrotic adhesions and scar tissue and helps the nerve to heal up quicker, increasing their conductivity. We'll be doing a video here later on about on Ryan doing his post-surgical rotator cuff tear rehab, which will be session number 4 for him. And he's already doing a ton better. He's only 3 weeks post-surgery right now. And I was asked on there if we could do ACLs and medial collateral ligaments, lateral collateral ligaments, medial meniscus tears, lateral meniscus tears. This will work on any joint, shoulders, elbows, carpal tunnel syndrome, post-surgical knees, and that includes total knee replacement, which we did on a veteran yesterday. Those are sore right there too, huh? These are the tensor fasciae. A lot of people call this their IT band. You notice this has different contact surfaces, so this one's probably more pointed, huh? That's pretty tender right there, huh? Okay, we're almost done. Sorry. Okay. Sometimes this might cause the video to get a little fuzzy. I know a couple of you made a comment on there and thought you were on mushrooms watching our video. But it's really just the high frequency. So Renee tried to stand far enough back today where that wouldn't interfere with that. Now, I don't normally do a side posture, but she's got some restriction in her SI joint, so I'm going to go ahead and have her lie on her right side and face me today.
Okay.
Just lay your head right there. No, go ahead and turn on your right side, yeah. There you go. Just put your head on that pillow. I'm going to bring your pelvis out to the front here. There we go. Now kind of let me have you rock forward and just relax. There we go. Excellent, yes. So that was a side posture Gonstead adjustment. Okay, let's turn towards me now. And you notice I didn't rotate it as much as I was driving it posterior to anterior, which is P to A. And that helps take the pressure off right where the nerve root comes out. There it is right there. Good, you bet. Let's turn you on your back now. There we go. So I am going to go ahead and decompress her lumbosacral spine from the lower end as well as her knees. There we go. Did you feel that in your knee and your back? Okay, good. Okay. There we go. Good job. Perfect. Okay, let me help you up sideways and let's face toward your knee. There we go. Good. All right, girl. Look straight ahead and keep your chin up. Ooh, that right shoulder's popping today.
Yeah.
Whenever you feel crepitus in the joints like that, that's an indication that the joints are out, and that just moved right back in place right there. You can see a little skip jump right there. Do you feel that?
Mm-hmm.
That's the labrum. Okay. There we go. Very good. Sherilyn, would you mind sharing with our YouTube subscribers what brought you in here and how the adjustments are working on you each and every time?
I was in a car accident about almost 2 years ago.
Right.
And I've been receiving other treatments. They were just lasting pretty much from treatment to treatment. They weren't.
You weren't seeing any progress over time.
Yeah, improvement over time. Actually, I had received also injections, and those did not help at all. But this has actually helped me with my posture.
Mm-hmm.
I'm not taking the pain pills as much. If I am, it's over the counter.
Right.
Even my muscle relaxers.
Good.
I've decreased it quite a bit.
Yeah, and she does that all on her own. We don't advise patients on medication usage. So.
These were from previous visits to the doctors, and the TENS unit helps.
Oh
a lot
yeah,
too.
yeah. We got her a transelectrical nerve stimulation unit that we get from preferred physicians out of Tampa, Florida. If you ever need that. Okay, let's come over here and shoot you. And then. So, do you feel better already?
Yes. I can actually walk.
Great. Okay. Now let's have you flex your head forward and then backwards here. I'm going to loosen this, lighten this up a little bit for you. I can set the amount of force also used in this high velocity, low amplitude adjusting instrument that I use on the Atlas on the x-axis. Now you can see she's still got a little forward head posture, so we want to bring her head straight. Might want to spread your feet a little bit further. There you go. Straight back and then up so that we can help get her ears back here over her shoulders where they're supposed to be and help her get rid of this little dowager's hump that's beginning to develop and get rid of the forward head posture, which is really what's creating all the increased weight-bearing compressive stress all the way down the muscles and ligaments and disc in the spine. You can relax, and let's have you flex forward and backwards now. Now you can see her range of motion's improved dramatically, and posture's already looking better now too. Very good. How's that feel?
A lot better.
Good. You feel any pain anywhere right now? Great. So she was coming in with 7/8 on the pain scale down in her low back and pelvis, and you're not having any pain at all? Or 1 or 2? Okay. Okay. And so this is your Houston chiropractor, Dr. Gregory Johnson and Cheryl Lynn, coming to you from Advanced Chiropractic Relief. We'll see you next time.